Welcome to Take Back Your Life Thursdays. Today we are privileged to be able to speak to Hanna Barden, who is a neuromodulation specialist with Boston Scientific. She actually has an incredible amount of experience um, with the aspect of spinal cord stimulation. She's been helping my patients and a number of other physicians with being able to help take away patients' chronic pain and get them back to leading lives that are fulfilling and successful. This is Hanna Barden. She's going to give you a little bit
Hi.
of further insight with the aspect of neuromodulation and how it is able to help people. What's the underlying gist of how to be able to get some further insight and really how to be able to get the best understanding of how this can benefit you. I'm Dr. Orlando Landrum. As you very well know, we do this every Thursday at 4:30 p.m. And really, one of the reasons why we did this in the first place was to be able to help patients be able to have access to tools so they can have some understanding about how to be able to take back control, how to be able to feel like they're still empowered, and really how to be able to make sure that they can be able to decrease their pain and really be able to lead functional lives. Okay, so we're going to get going with a few different questions, but before we get into those full questions, we want to kind of give you a little bit of plug for some of the stuff that we do in terms of cutting edge and how that can potentially be beneficial to patients. Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love. One of the things that I want to do is kind of give a little bit of background about Hanna. So Hanna is actually from LaPorte, Indiana. She has been a phenomenally intellectual, like, savant for years. So when you actually start going and taking a look online, you can see that even back in high school, she was kick butt intellectual. And then in undergrad, she went to Purdue University North Central. I'm going to embarrass her a little bit, but she's not on camera right now. You can see that she was on the dean's list multiple different times and that she was just kick butt, take names constantly. Following the aspect of Purdue, boiler up, by the way, she went to Loyola University Chicago and did a master's in biomedical science. And currently, right now, she's pursuing a PhD, as a matter of fact, at Northern Illinois University, which we're going to get into a little bit more depth and detail as we kind of go along. So we want to ask Hanna a number of different questions, and we're going to kind of get into this just in a moment or so. But one of the things that I want you to know that is probably one of the most important things that I would probably say for patients is the following: is that many different people that have interacted with my patients, both her and her partner Tom Best are some of the best at making people feel comfortable. And I think when we talk about a number of different treatments that are kind of complex and very involved, many people feel like they can't ask questions because they think that someone's going to look at them and feel like they're stupid. And in our office and in offices in general, we want people to know that that's not something that we want to really have you feel. We want to make sure that you have that understanding that you can be able to ask questions, not feel limited, and that you can do whatever it is that you want to do by us helping you get back to that state. Okay? All right, so let's get back into talking to Hanna a little bit and getting into that gist of having some understanding about what it is that neuromodulation happens to be and how to be able to get some insight about what's going on. So Hanna, you work for a spinal cord stimulator company, correct?
Yes, I
So
work
spinal
for
cord
Boston
stimulation.
Scientific.
Yes, Boston Scientific. So spinal cord stimulation is a form of neuromodulation. For our audience, what exactly is neuromodulation?
So neuromodulation kind of encompasses a whole lot of different things. There are different types of neuromodulation. It ranges from deep brain stimulation, vagal nerve stimulation, peripheral nerve stimulation, and obviously spinal cord stimulation, which is what I'm mainly here to talk about. They really treat a wide variety of conditions. Specifically, spinal cord stimulation, we're dealing with chronic pain. Um, Different conditions that we're treating include like failed back surgery syndrome, radiculopathy, CRPS, just a breadth of conditions we can help treat.
Okay. So, getting down to that, many patients hear the word spinal cord stimulation and they think that, it's a scary term, like you're digging or cutting into the spine. Can you help explain a little bit what spinal cord stimulation really is so that people can understand?
Sure. So, spinal cord stimulation, that's one of the biggest things we run into out in the field. It sounds so much scarier than it really is. Most patients have been through back injections or epidural injections, steroid shots, that kind of thing. It is very similar, but instead of injecting medicine, we are injecting or essentially placing leads into the epidural space. So we're never actually touching the spinal cord. We're not going into the spinal cord. We're not cutting you open right away. You're going through a trial phase to make sure it works before you pursue a surgery. But yeah, we're actually far away from the spinal cord. We're just stimulating spinal nerves.
Okay. So, are there other types of neuromodulation other than spinal cord stimulation?
Yes, so there there are different types of stimulation out there if this is what you're referring to. Like dorsal root ganglion. There are different types of programming for spinal cord stimulators, traditional programming. Then we've also got high rate programming, which are different ways in which we can treat different types of pain patterns. Um, yeah.
Okay. So, tell us a little bit about what's your PhD about and how did you and why did you pick that discipline of study?
So I'm definitely staying within the pain management realm. I have a passion for pain. I love everything about it. So I've decided to study pain detection. Essentially means is the ability of a dog to detect medical conditions in humans. So I'm specifically looking at pain management, most likely through cortisol release. Cortisol is a hormone in the body that is released during a pain response and stuff. But that's currently what I'm looking at, and how we can essentially improve pain detection methods, particularly for populations that maybe can't communicate, such as infants or mentally incapacitated, or the elderly, just anyone who can't tell us they're in pain.
Okay. So, um, you work for a spinal cord stimulator company. Prior to that, you actually were working with another company that I think changed names for a bit. Originally it was Eaglet, but now it's Zyla Life Sciences. What made you choose spinal cord stimulation as an interest?
So I loved my previous job. I was able to help patients gain access to new medications for their pain, but there was something missing. And I think the fact that I really didn't have any patient interaction. And given that I had been working in pain clinics, I stumbled upon spinal cord stimulation and I knew instantly. I was like, that is what I want to do. That is so cool. And I think the future really lies in non pharmacological approaches to pain. So, like medical devices or regenerative medicine, those type of things that isn't achieved through taking a pill. So I've always been super fascinated with the spinal cord stimulator, and I love my job. I think it's quite obvious I love my job, and I'm just blessed to be here and to be talking to all of you.
Okay. So, you mentioned your job. So, what's your formal job description?
So I am a clinical specialist or a clinical representative for Boston Scientific. So what that means is I am kind of the person that is every step of the way. So prior to the procedure, I am meeting with patients, discussing the procedure, addressing any questions, going over your pain pattern to see if it's a right fit. And then as you move along in the process, I'm actually in the operating room when we're doing the procedure. And then if all goes well during the trial phase, I'm with you during the surgery. So you're kind of stuck with me.
Okay. So
So
let me
let me
ask you a
ask you a
quick
quick
question in
question
that
in that
regard.
regard.
So
So
I don't
I
know
know
how
how
it
it
is
is
for
for
you,
you,
but I
but I
know
know
how it
how it
is
is
for
for
me.
me.
So
So
what
what
I
I
do
do
and
and
what
what
my
my
parents
parents
think
think
I
I
do
do
are
are
completely two totally different things. So when we talk about the aspect of your job, how would your mother kind of describe what it is that you do?
So I actually went straight to the source and I asked her right before this. And she said that I'm concentrating on helping people to get out of pain, have a normal life again. Essentially, the stimulator goes inside and tries to block chronic pain signals and helps people not be in pain. I think she nailed it.
Well, you can't really cheat and ask your mom now. You gotta figure out
I
like
was
what's going
curious.
on beforehand and what you think she would say. Okay, so I think you talked about multiple different types of spinal cord stimulation before, right?
Yep.
So, of
Yep.
the different types that are out there, what are some of the main ones? Would you say?
I would say traditional stimulation or your paresthesia based stimulation, which is essentially, it's been around since the mid 1900s. It was our very first stimulation technique based off of the pacemaker. It's the tingling the patient feels, really good for like leg pain, sometimes helps back pain. Didn't really change a whole lot for the first 70 years or so. Up until about 2010, the late 2000s, we really started getting fancy to where we started seeing higher rate programming. And there's different ways now we can treat focal pain through dorsal root ganglion, things like that. But I would say the main difference with the high rate programming that we do, we actually can run it in combination with traditional stimulation, is we're targeting a totally different part of the spinal cord.
so hold on a minute, Hannah, because you're getting too fancy. Like we're not fancy. Take Back Your Life Thursdays is all about having an understanding about what's going on. So let me back up just a little bit and ask you a question. So specifically, it sounds like Boston Scientific does some things that are a little bit different than other companies. So can you give us an idea about what that is, and then why you might pick one type of stimulation versus another?
Sure. So every company kind of has what they're good at or what they're doing differently. Here at Boston Scientific, we kind of put an emphasis on combining different mechanisms or essentially combining different ways to do stimulation and putting them together to where you're getting a dual mechanism. So, two things working out. The easiest way for me to kind of explain that is if you think about your medicine. So you've got Tylenol, you've got ibuprofen, they work differently. Sometimes if you join the two, they're still working, they're working together, they're working differently. So that's kind of the approach we're taking with stimulation. We've got traditional stim that we can run in conjunction with our new high rate programming to where then they're both working at the same time. But that's kind of what our niche is, and there are no other companies right now that are able to truly do that.
Okay,
Okay,
so
so
quick
quick
question
question
for you.
for you.
I
I
know
know
I
I
have a
have a
number of
number of
patients
patients
when
when
I
I
talk
talk
to
to
them
them
about
about
stimulation
stimulation
where they're really concerned about whether they're going to feel this tingling, this burning sensation, and that's what's going to cause them a problem. So
So
when you
when you
say
say
high
high
rate,
rate,
does
does
that
that
mean that
mean
they're
that they're
just
just
getting
getting
peppered?
peppered?
Or
Or
what
what
is
is
that
that
like?
like?
Can you
Can you
explain that
explain?
a little bit?
Sure. So your traditional stimulation is the one, like I mentioned, it's the tingling sensation. Average patient likes the way it feels. It feels like an internal massage. Some patients that don't like it. So we have another option, these higher rate programs that allow you to run stimulation at a level that you don't feel. So this essentially you don't even feel it running, but it's because you're noticing your pain decrease. So that's kind of the idea. You've got the one up top that you feel, you can turn it up and down like the volume on the remote, or you can choose to run these more fancy programs that run at a level you're not perceiving. They're doing differently on the nerves.
Okay. Do you have a preference for one versus the other?
I have a preference for both, just because we can run them at the same time. Everyone responds differently, but what we've found is that most patients tend to respond to both, so why not run them in conjunction? But obviously patients are going to have preferences, so we kind of go based on the patient. Sometimes the patient at nighttime will want to turn it up where they feel it, but during the day they don't want to feel it, and they have that option.
Okay. So, what is the one thing that spinal cord stimulation did for patients that you didn't expect?
So that's a really good question, because it takes me back to my very first case where this patient like groceries or something, or like walk into the mailbox, and it's things that you take for granted, you don't really think about. So I think just giving patients their life back to be able to do very basic things. Some patients have a goal of going back to work, and we've got several patients that have been able to achieve that goal. So I think just kind of giving them their life back when they thought they couldn't or they wouldn't have that option has been rewarding.
All right, Hannah. So, I'm going to actually kind of pull on your heartstrings just a little bit. So, because I can't have you being so composed here, right? Is there ever a patient that made you cry because they got so much improvement and you were able to say, I impacted them greatly?
So you know this question because I feel like I cry in front of you all the time. But yes, it is so often where I will just be in that room and patients are like, I haven't felt this great in years. I have one patient in particular who couldn't even sit down on a chair without spasming, could not sleep. During her trial phase, it was a little bit slower of a trial phase. The first couple days, she was like, man, I don't know if it's working. And I remember that Saturday, she woke up and she was pain free. And not to set the expectation that all patients, 100% on, but in this particular, she did end up going on a feeler, which we do not recommend.
Say that one more time.
But this is sitting and she was feeling so good. She was years. She was able to play with her grandkids and love it.
So, what's a common myth about spinal cord stimulation, and can you debunk it for us, please?
Sure. So I think we kind of touched on it, because I think the most common thing patients come in is they're like, oh, I don't want anything touching my spinal cord. Like, it's so dangerous. I'll get paralyzed, that kind of thing, which obviously that is a risk. There are risks involved with spinal cord stimulation, infection, loss of therapy over time, that kind of thing. But we are still so far away from the spinal cord. We're not entering the sterile starting. So I think just making patients aware that spinal cord stimulation sounds scary, but it's really not.
Okay. So, neuromodulation companies are constantly improving their offerings to patients. What's your company most curious about right now?
I would say our company has a real big focus currently on combination therapy, which we touched on. Just the different programs, how we're able to run them in conjunction. We're also very focused on individualized therapy. So not a one size fits all. We really target our programming and our approach to each individual patient based on their pain pattern, their pain type, as well as keeping into consideration what their goals are and long-term outcomes. So we really put the patient at the core of what we're doing every single day. But we're also trying to put a focus on some new technology for patients that should be launched here pretty shortly. where it just kind of increases access. App called My SCS, which patients have used for their trials in the past. So.
Okay, so basically you're keeping a few things close to the vest as we kind of expected. No worries on that. So, if you could step into my shoes, what would you have asked yourself that I didn't?
I think I would have asked more about the actual process. Um, I think most patients think this is a surgery right away, but that's not true. You're generally meeting with us for a consultation or at least talking to me on the phone. Sometimes patients are meeting with me kind of over a format similar to this, answering any questions, making sure you're comfortable. Then you're going through a trial phase, which is generally a week long. This is kind of like test driving a car. We want to make sure it works, and you've got to convince me it works in order to move on, because I want to know the right people are getting these devices and that it's going to work for them. After that week's over, we kind of go over, how you did, and then you get scheduled for the surgery. The surgery is then all under the skin. So trial phase, you had everything externalized. You're taped up really, really good. There's no incisions, nothing like that. But permanent implant wise, then you get 2 small incisions, one in the middle of your back, one on either the right or left flank, and everything gets tucked under the skin to where then it is a permanent option. You can kind of live your life once you're all healed up. And then you're, again, stuck with me for the duration you have the device.
Okay. All right. So let's kind of ask you a non-professional career type thing. Let's move off of this and just ask you just simple question about you. So I think both you and your family are Steelers fans for whatever reason. So of the Steelers, of the following three, who do you think was the most impactful to the franchise? Troy Polamalu, Hines Ward, or Rod Woodson?
So Rod Woodson was kind of before my time. I mean, I was around, but I was super young. Don't really remember him. Troy Polamalu, of course. I mean, everyone knows Troy Polamalu. He's superhuman on the field. I've seen him play. Hines Ward, just in general, great all around. But I'm actually really disappointed you didn't include Jerome Bettis on this, because he is by far my favorite, and I feel like he has some of the most impact for the team.
All right, Hannah, I know that you're ad-libbing. The reason why I didn't include Jerome Bettis is that all of that is posted across some of your social media network, and we actually also want to congratulate you because you're going to be getting married, as I understand it, sometime around May 30th of actually this coming month in a few weeks or so. Is that right?
Thank you. Hopefully, we might have to push it back with this whole virus situation, but we're going to figure it out here shortly.
Okay. So, in having this discussion today, 3 years from today, if you were to look back over these 3 years to today, what has to have happened, both personally and professionally, for you to feel happy about your progress?
That's a really tough question. I would say, obviously, I want to graduate because I always joke and say I'm mentally unstable as I'm going through this PhD process and working full time and planning a wedding. Is just like, whoo, there's so much going on. But I hope in my personal life, I am married. I graduate, of course. That's going to be my biggest. And then professionally, I hope still with Boston. It's just the best company to work for. So hopefully maybe something to do at that time, but right now what I'm doing.
All right. Thank you so much for your ability to be able to help our patients learn and get some insight about neuromodulation, make it less daunting, and make them much more under the ability to be able to have an understanding about what's taking place. Hopefully, you'll join us sometime in the future, and we'll have you back and have you talk about neuromodulation a little bit further. Thank you so much for your time, and have a great day.